Because Alzheimer's disease is the primary diagnosis for dementia and the assessments and nursing interventions are primarily the same for all patients with dementia, this section will focus on Alzheimer's disease. Most major neurocognitive disorders, such as Alzheimer's disease, are related to a primary encephalopathy. According to the DSM-5, Alzheimer's disease accounts for 60% to 90% of all dementias in the United States, and in 2015 was the sixth leading cause of death in adults in the United States. Every 67 seconds, someone in the United States develops Alzheimer's. Primary neurocognitive disorders have no known cause or cure. Thus, they are progressive and irreversible. In 2011, the Alzheimer's Association revised criteria and progression of Alzheimer's and major neurocognitive disorders due to Alzheimer's. Examples of other major primary neurocognitive disorders include vascular dementia, Pick's disease, Huntington's disease, Creutzfeldt-Jakob disease, and Lewy body disease, and Parkinson's disease. Histologic changes in Alzheimer's disease: A, healthy neuron; B, the neuron is affected by Alzheimer's disease, showing characteristics, neuritic plaques, and cellular neurofibrillary tangles. Alzheimer's disease is incurable, a dementia illness. It's chronic, progressive neurodegenerative disorder. It's marked by cognitive dysfunction. Onset is usually between ages 45 and 65. Pathophysiology: cholinergic neuron degeneration and acetylcholine deficiency. Neuritic plaques form and neurofibrillary tangles are in the neurons. Alzheimer's disease is divided into 4 stages, stages 1 through 4, depending on the severity of the illness. Stage 1 is mild. In this stage, you're going to see forgetfulness, possible depression. Early stage starts off with a loss of energy, drive, and initiative, and has difficulty learning new things in this stage. During the mild phase of Alzheimer's, apathy is the most common behavioral problem to appear early, and it often persists throughout the entire disease process. Activities such as grocery shopping or managing finances are noticeably impaired during this phase. Stage 2 is moderate. Again, you're going to start seeing more confusion, memory gaps, self-care deficits, apraxia, and labile mood. Symptoms of Alzheimer's is memory loss, confusion, inability to communicate, aggressive behavior, depression, psychosis. Progression leads to loss of memory, logical thinking, and judgment. Time is disoriented, personality changes, hyperactivity, tendency to wonder. They will have inability to express themselves. And later, they may show signs of hostility and paranoia. Assessment for Alzheimer's disease. There's usually they have difficulty finding the right words. They use familiar words repeatedly, and they invent new words to describe things. They will lose their train of thought pretty quickly, rely on nonverbal gestures, and cognitive impairment involves the 4 A's: amnesia, which is memory impairment, Aphasia, loss of language ability. Apraxia is loss of purposeful movement in the absence of motor or sensory impairment. And agnosia is loss of sensory ability to recognize objects. As nurses, we need to assist in providing referrals for counseling and communication techniques to both the patient and family members, health teaching and health promotion, referral to community support systems, and then pharmacologic interventions, a lot of teaching on medications. Patients may decline at different rates, but providing safety is a very important part of nursing, whether it's for the client in a hospital environment or it's teaching the client and family for their home environment. We need to make sure that throw rugs are removed. Anything that could result in a fall or injury is out of the way. If they have seizures, we need to educate the family, especially on what to do for those. We want to label rooms. Often we have to use objects that the patient can recognize so they know which room is theirs if they're in the hospital setting. And installing safety bars in bathrooms, on stairs and steps, things like that need to be done for safety measures. Wandering is a part of Alzheimer's disease, especially as it progresses. We want to maintain their safety while also providing barriers for them to get out and get lost. So placing a mattress on the floor helps with safety issues. Providing a medical alert bracelet if they were to wander off and be found by someone else, or especially by a healthcare provider or police officer, they would have that information. Identification is important to also have on them. Notify the police department with photographs if they become missing or are wandering, so that they can easily and quickly find them or help to find them. If they're in the hospital environment, you want to have the patient wear a brightly colored vest so they're easily seen. At home, you want to install complex locks on the doors. This keeps them from being able to either get out or figure out how to get the locks open. Exploring feasibility of sensor devices to help keep track of when doors open or windows open. I have a stepmother who is currently in about stage 3 with Alzheimer's disease. And we have found a special watch that you can put on that they cannot get off. It's a special way to get them off. It's complex, but it can be followed with your cell phone, a smartphone, and if they wander off, your smartphone will alarm, and it will show a map, whether they're on foot, walking, and you can track them down pretty quickly. So there's several new devices out there that aid in helping keeping these patients safe. Activities are still important for patients with Alzheimer's disease. They like to fidget a lot, especially in certain stages. Provide pictures in magazines, as long as they're able to sit down and look at them. A lot of times they don't want to read or can't read at that point, but they can identify some pictures. You do have to watch this to a certain point, because eventually they don't know what to do with the magazine, and you're liable to find it pretty much anywhere. Provide simple activities, easy things for them to do. There's several available toy type activities for adults with Alzheimer's disease to keep them busy. Activities that are familiar to them are usually better for memory, because they kind of remember what to do with those things, especially if they've done it long term. Physical activity during the day is important. We all know how important exercise is with the body, with constipation, all those things. So walking is a great activity for these patients, as long as they're with somebody. These are some community services that are usually available in the area and in-home services as well. There are many places that will take care of your family member with Alzheimer's by either coming into the home or allowing you to bring them to them as a daycare center for adults. Support groups are very important for the patient and also for the caregiver. Caregiver burnout is a really good nursing diagnosis and is very, very common in people caring for clients with Alzheimer's disease. Meals on Wheels helps with nutrition. There's always hotlines for important questions or overnight questions. And the Alzheimer's Association has all kinds of information online that's easy to get to, connections with support groups and stories of other patients, and lots of medical information for those people who are searching for that. Communication guidelines for dementia and Alzheimer's diseases. Always identify yourself when you come up or approach a client. Don't assume that they're going to remember who you are. Call the person by his or her name at each meeting or each time you see them. Speak slowly. Use short and simple words and phrases. Be sure and look them face to face so they can see you while you're talking to them. Be near the patient when you are talking. About 1 or 2 arms lengths away is usually appropriate. Focus on one piece of information at a time. Talking about familiar things to the patient is usually helpful. Encourage reminiscing. Don't argue with them or refute delusions. Keep the patient's room well lit for safety. Provide hearing aids or glasses if that's appropriate. Have clocks, calendars, and personal items such as family pictures in the Bible, maybe their Bible, in clear view where they can see them and not have to think about or remember them. Reinforce patients' pictures and nonverbal gestures. Put X's on calendars to help them keep up and use other methods to present reality to them. If a patient gets into an argument with another, separate the individuals. After about 5 minutes, then you need to explain your intervention. If the patient is verbally aggressive, then acknowledge the patient's feelings and shift the topic to a familiar ground. I know this is upsetting you because you always cared for others, and move forward. Pharmacologic interventions for Alzheimer's disease. Remember, there is no cure that exists for Alzheimer's disease. Prescription drugs currently that are approved by the FDA for use with Alzheimer's disease include cholinesterase inhibitors. They delay and prevent symptoms from becoming worse for a limited time. They're useful in treating mild to moderate Alzheimer's disease, and they prevent breakdown of acetylcholine, and they stimulate nicotinic receptors to release more acetylcholine. On your slide is some examples of these medications. So acetylcholinesterase and cholinesterase inhibitors. One example is the Exelon. Assessment for this includes assessing the patient's mental and physical abilities, obtain a history, especially hepatic or renal dysfunction, and assess for memory and judgment losses. Nursing diagnoses that are appropriate are self-care deficit, toileting related to memory loss, and confusion chronic related to memory loss. Planning includes patient's memory will be improved and patient will maintain self-care with assistance. Other pharmacologic interventions that need to be considered are for coexisting depression. The choice is usually based on the side effects profile. Selective serotonin reuptake inhibitors, which are the SSRIs, they have low side effect profile and they're usually well tolerated. Remeron is causes weight gain and sedation side effects, and it may actually be desirable for some patients. This slide has information on Alzheimer's support for family and individuals in the community.